if he did not die within 1 month. After 1 month of treatment, he was healthier than before and was able to get out of bed. His gastropy showed that the cancer and ulcers were gone. Since then, his expert panels were convinced and never dared to challenge me. Sometimes we prefer to challenge the conventional medication, but finally you can see from the results who is the winner. That is it. This is regenerative restoration. What I do is to help medicine resolve medical problems, but medicine is still medicine. Our regenerative restoration science is totally different from it being both of them can contribute to the health of human beings. One should not deny the other. Moreover, medicine has a much longer history, and regenerative restoration science can resolve the problems that cannot be resolved by medicine. For example, ulcers create a big hole. Although there are many therapeutic methods in medicine to cure ulcers, scarring will result. However, our science can cure it without scarring, and the chances of relapse is slim. Scar tissues lack the function of self-protection. Before, the gastric ulcer was classified as an intractable disease due to its scar-causing reoccurrence. But with regenerative restoration science, ulcers won't be refractory anymore. So this is what regenerative restoration science is. Then, let's move on to rejuvenation. Actually, there's no difference between the internal organs of body surface organs. Let's see the duodenal scars. Through regeneration, the duodenal scars is gone, and villi grew again in the scar area after the scars disappeared. So what other names can we call it other than rejuvenation? When villi disappears, we can make it regrow again. And this is indeed the process of rejuvenation. I believe all of you have a better idea about the concept of rejuvenation, but this just shows if there is no premature aging, there is no rejuvenation. Next, let's see the actual status of the GI system. We've observed it using the SB endoscope. The endoscope is swallowed to pass through the GI tract and radiates electronic signals which are recorded into video. In this way, we can see the changes that have taken place in the whole GI tract, such as the stomach, small intestines, etc. Let's see these pictures. You'll be astonished by what you see. Pay attention to the appearance of the GI in different age groups, and especially to the GI villi. Intestinal villi are very scarce, short and thin in the 60 to 70-year-old age group. Intestinal villi are longer, but still scarce in the 50 to 60-year-old age group. This is the 30 to 50 age group. Intestinal villi are relatively denser than that of the 50 to 60-year-old age group, while villi are much denser, longer, and thicker at 25 years of age. Without the comparison with the 25 age group, you may not realize the obvious difference between the 60 to 70 age group and the 40 years of age group in the latter is just a little longer and denser. By examining the 25 years of age group, we can see that the intestinal villi in the 25 years of age group shows the normal, healthy state of the GI. So you must be astonished by this comparison. GI systems play an extremely important role in our human body, and it is absolutely more important than our appearance. Only when your GI system is in normal and healthy state can your other organs work efficiently. Otherwise, things would be different. Today, I will show you how to restore a senile GI system into a younger status. This is the duodenum at 60 years of age. The stomach is at the age of 25. All of you can make a comparison. Look at the mucosa, which is at the younger state. This is the younger duodenum. This is the restored duodenum. So, although we cannot return to a youthful appearance, our GI can